You've heard us talk about Shisha. What is Shisha? Make me understand. Let's hear it from the tobacco people from KETCA.
I will say that Shisha is just a tobacco consumption method. It has been there for a long time. Many people will think that this is a new thing, but it's been there from the Middle East and other Arab countries. Shisha has been used for centuries. But now it's getting popularity in some of the East African countries and African countries.
Yes.
Because it looks or appears to be trendy, especially the glass that it's consumed through.
Yes.
Yeah, that's what is actually gaining attraction. People want to see or to know what is this new thing that is coming around in our restaurants, bars. But basically, it's just a tobacco consumption method.
It's just a different way of consuming tobacco.
Sure.
Anything else that we can add? Because tobacco has been consumed in different ways. We see our great-grandfathers and our ancestors actually, snuffing something, and still tobacco. It's still in the name of tobacco. How they rolled it in what? Banana leaves or something like that. So it's just the same tobacco, but this time round it's tobacco in some decorated vase, for lack of a better word.
And some few flavors.
And some few flavors added to it. Nothing so hype about it.
Yeah, actually, just to add on to what my colleague is saying, besides tobacco, what they've done is there are other additives and flavor. So what they're trying to say is they're telling you cigarette smoking is dangerous. So what we are bringing you this new product, which is less dangerous, safe alternative to this.
Safe alternative?
Yes, and it has been glamorized, and that's why you see more ladies are attracted to consuming shisha.
Obviously, because of the colored, it's actually another flower vase with water.
Exactly. So that's basically the catch behind it.
Yeah.
So the ladies are attracted to it, the young people are attracted to it,
yeah.
And in essence, at the back of it is that people are still consuming the dangerous tobacco that you're trying to warn people about.
Okay.
Yes.
Collins,
Yeah.
your club, tell us a little bit about your club. Where is it situated?
It's situated on Nyangomi Road, Kilimani, just opposite Casablanca.
Opposite Casablanca.
Yeah.
Club Bedouin. And what sort of clientele do you have in your club?
We have a very nice clientele base. Looking at the VIP, we have a very nice setup of the VIP. We host parties. Yeah, and then we have employed a couple of guys who are really working on the shisha, some young guys. So whenever it comes to this shisha ban, at the end of the day, I think it's just politics.
You think it's politics?
I think it,
Wait a
I
minute.
don't think it
did
is politics.
your clubs, did you start the club with smoking of shisha, or did shisha
Actually,
came into being?
Basically, it used to be just a shisha lounge. That was last year. But at the minutes of the year, we decided to add a bar on top of it. So right now it's a bar, but since they banned the shisha, so at the moment it's just a bar.
It's just a bar.
Yeah.
Now, let's get into the numbers, because yes, there was definitely a reason as to why you got into this, other than just people enjoying. The mission statement would definitely be people, let them enjoy the shisha. But of course, there's a little bit of money being consumed, or rather being spent on this. How much was a shisha session? How much would I pay to have shisha in your club?
You'll pay just that amount of 1,200 shillings.
1,200.
Yeah.
Now, on average, how many minutes does it take for one to consume the shisha?
Okay, the type of shisha that we have, it's kind of on a good level, so you'll smoke it.
You say that shisha is also categorized in levels?
Yeah, you can go to some clubs, you smoke shisha, which, okay, you can smoke it for like 10 minutes, 20 minutes, and then it will, at the end of the time, after 20 minutes, it will be trash, Yeah, but us in our place, you can smoke it for like basically 1 hour, 45 minutes. At that duration of
45 minutes to an hour.
Yeah.
So in just 45 minutes to an hour, 1,200 has already gone up in smoke.
For sure.
Right. And according to the health experts, they say that is actually 7 or 10 times more than just the average cigarette smoke.
I don't agree with that, because if you really if you just put this into facts, that can be very, very, very opposite. If you're saying like one puff of a shisha is that 10,000 of a smoke, we have guys who have smoked shisha. Let's look at Middle East. At the age of maybe 12 years until right now, maybe they're like 40 or something years, and guys are they're still alive. So there's no way you can tell me, it's something like, it's like telling me, there's someone who can smoke cigarette in 1 month and can get lung cancer. There's someone who can smoke cigarette for the rest of the year. I mean, for the rest of his entire life, and he will still be alive. You get that? Yeah, so there's no way you can say that one puff
So
of a shisha.
are you the person who says that, no, the government, the health...
Yeah, for sure. That's just politics at the end of the day. Okay, most of I believe is the tobacco industry, because, you know, Kenya is not a dictatorial state, right? You just wake up in the morning and declare shisha ban with immediate effect.
Okay.
Yeah.
Your club is a shisha lounge. Used to
It
be a
is. It
shisha
used to
lounge
be
until
basically.
Cleopa Mailu said, no, we
Yeah.
don't want the shisha. Were people smoking cigarettes in your club?
Yeah, people are smoking cigarettes.
So when you look from when you sit in the club and you watch, how many people were smoking cigarettes? Is it more than the ones who were smoking shisha?
No, less of them are smoking shisha.
So less people smoking shisha?
Less people smoke cigarette.
Less
More
people
smoke shisha.
So more people smoke shisha,
Yeah.
less on cigarettes.
Yeah.
When you sit there, would you want to know why?
We don't even sell cigarettes at the club.
But people come with their own pack of
Yeah,
cigarettes.
people come with their own pack of cigarettes. Yeah.
Interesting. KETCA.
I think what's missing is their concern for the public health. They are oblivious of the fact that if you are smoking and I'm sitting near you, I'm also smoking.
Yes.
I'm a second-hand smoker.
Yes.
And in such places, you can't really control who is coming in, who is coming out.
Right.
Children may come in.
Children?
They'll be exposed
Yes.
to such...
There's no way you can have children under 18 inside a premises like that.
but it happens.
No, it doesn't happen.
Okay, in any case, whoever comes in and is not interested in smoking, he'll be exposed to the fumes from the smokers, and this is a public health concern. And you're talking about politics. I don't see the political angle that this thing is taking.
Maybe the question of political angle would be the stakeholders in the tobacco, main tobacco, seeing that their revenues...
Just wake up in the morning,
seeing their
and ban
revenues,
shisha.
and seeing their revenues...
Just a minute. At some point of view, at some point of time, shisha was banned in Kenya. Remember, like 5 years ago, they kind of banned it, but nothing happened.
It was sneaked in back into the public domain, right?
Yeah, definitely. That's what I'm saying.
Actually, I think we might be having a problem with over-politicizing issues.
Let's go straight into it.
This is the Ministry of Health, who've been mandated to protect and safeguard the health of Kenyans. And by the advice and wise counsel of the World Health Organization, the Ministry of Health deems it fit to ban this vice. Why should we politicize that? One thing that we note is that shisha is a new way of consuming tobacco.
Right.
And over the years, a lot of research has been done on the harmful effects of tobacco.
Yes.
Why do we want to exonerate shisha? And on the other, we've already seen that there are deadly effects of tobacco.
Yes.
Secondly, from the research that have been conducted with very credible institutions, like Center for Disease Control, National Health Society, they found out that shisha, consuming shisha, you are consuming toxic chemicals. And one session, which he's rightly said, that goes from between 45 minutes to an hour is equivalent to smoking 100 sticks of cigarette. 100 sticks of cigarette.
Right.
According to WHO, each and every passing second, someone dies because of consuming tobacco.
And secondary smoke.
Yes. So why do we want to sugarcoat this issue of shisha and trying to politicize the issue? It's already known factually, research has been conducted, and we have evidence. Why do we want to exonerate?